We're so glad you're here.
We believe in bringing in experts to inspire and to educate women so that they can live empowered, fulfilled, and successful lives.
When women support women, we change the world. Here we go.
You're going to love this program. So Nancy, I'm so excited. Our guest today is a nationally recognized cardiologist and has this incredible national platform on women's heart health. In fact, she's been recognized nationally, and she also earned the 2020 award for Women's Day Red Dress Award. A big honor. Our guest, Dr. Annabelle Santos Volgman, a professor of medicine and senior attending physician at Rush Medical College and Rush University Medical Center. She's also the medical director of the Rush Heart Center for Women and chief of academic affairs for the Division of Cardiology. Annabelle, it's so wonderful to have you back in front of our Women's Forum community, wearing your signature red clothing, which we're doing in honor of you, to remind people that heart disease is still the #1 killer of women.
Thank you so much, Barbara, and thank you, Nancy, for having me here today. And it's in honor of women with heart disease and to spread awareness that heart disease is still the #1 killer of American women.
Where did that myth come, Annabelle, that it was a man's disease?
Well, unfortunately, when we were studying heart disease, we noticed that men were dying of heart disease at an earlier age than women. And so we all worried about the young men dying of heart disease. Women tend to have heart disease later than men, about 10 years later. Our estrogen or our premenopausal state probably protects us from having heart disease. When I talk about heart disease, I'm talking about coronary heart disease. Women get all kinds of heart disease that is not coronary artery disease at a younger age. But when it comes to heart attacks, men get it at a younger age. And I think people were worried about men dying suddenly, and women didn't tend to do that as much. But women were dying of heart disease more than men in numbers since 1984. And we didn't worry about the women as much. And so the American Heart Association and the national health organizations like the NIH really got on board with trying to educate women and doctors about the risk of heart disease in women and men.
Well, I know you do a lot to that end, so thank you so much, especially with the Women's Heart Center. So we want to jump in. Our current Women's Forum theme, Annabelle, is designing and living your brilliant life, and that is you personified. Can you tell me and Nancy, what has been the source of your courage to be so confident and to create such a big and brilliant life for yourself?
Well, thank you so much. I would not say I have a brilliant life, but I have a happy life. I have very loving family and friends and a very supportive husband who, we don't always get along, but in terms of his support of what I do, especially as a cardiologist and helping people and making sure that our family is safe, I think he's been the most amazing partner in life. I would say that having somebody who is very loving and supportive has really helped me get through a lot of hard parts of my life. He's been with me since I was an intern, which means that after you graduate from medical school, you have an internship, and that's probably the hardest time for a doctor because you're on call all the time and you're taking care of a lot of patients and you don't know much yet. You're learning how to be a doctor. And he's been with me since then, and he's just been incredibly supportive of the work that I do.
That's fantastic. I mean, I totally understand and appreciate the importance of having that, that partner right next to you. I'm curious, Annabelle, as a cardiologist, you're in a male-dominated specialty, right? And so, how do you help other women, both in medicine and outside of medicine, um, you know, kind of come into their power, own their power, be courageous, and own their voices and find fulfillment in their lives?
Thank you for that question, Nancy. I do a lot of mentorship and sponsorship of my fellows, my daughter, my residents, my students, and it's not just women. I also mentor and sponsor men. But when it comes to finances, it's the women that need more help. They don't like to talk about money. They are afraid of money because when you're a doctor, all you care about is how to be a good doctor and how to care for people.
Mhm.
And it's almost a taboo to talk about your salary and investing your money. And what I'm trying to teach them is independence. When you own your money, when you know what your money is doing, where you're investing your money, making sure that that hard-earned money is working for you, then I think you have some feeling of independence and peace of mind that you are supporting yourself and that you can be independent and not ever dependent on a man or a spouse or a partner. I think independent peace of mind.
Yeah, and it's interesting because I hear what you're saying. Barbara and I strongly believe that money is power, and in the way that it gives women the opportunity to make choices in their life. And I hear what you're saying, that the importance of starting to have conversations early and claim your financial independence and not relinquish that power, to somebody else, whether that's your spouse or an advisor or whoever. That having that voice and maintaining that power is really important. Is that what you're saying?
Absolutely.
Yeah.
My mom was working for an investment banker. She was a teacher in the Philippines, and when she came to the United States, she started working for an investment banker, and she started learning about what he was doing with wealthy people's money. And so she
Right.
really learned how to make her money work for her. And so she was able to retire at 62 and did whatever she wanted. So I definitely learned from her about, sorry about that. I definitely learned from her about what to do with money and be financially independent.
But I love, Annabelle, your story, because you've really encouraged us to do presentations to your team members, to women and men, especially women, to step into their power and own their voice when it comes to money. But you share your story as you beat that pound the table to them, that you initially weren't focused on financial issues, and it wasn't until your first maternity leave that you finally took the time to learn about investments.
All right, true confessions. I was one of those women who didn't really want to talk about money or worry about money. I just thought, it'll just come. And I noticed when I was an intern that my male colleagues were saving their money. And I said, well, why do you have to save money? He goes, well, I'd like to have a house someday and pay for things. And I just didn't think of that. And it wasn't until, I could barely have enough money as an intern and resident and fellow. You don't earn enough money. You don't earn a lot of money. So there was no money to save, at least from my standpoint. I don't know how he did it, but I just spent more money than I probably should have. But it wasn't until the dot-com boom when everyone was talking about the stock market. And I didn't even know what a stock was at that point. And somebody shamed me. My husband shamed me into saying, he said, well, you're 38 years old and you don't know what a stock does. I said, well, don't know. I was taking care of my patients and learning about medicine. And so I decided, since I just had a baby, that I had maternity leave and 3 months to spend a little more time away from the hospital, that I learned about the stock market and I became brave enough to invest in the stock market. And it's done very, very well since, and I'm so glad. And I actually did not know what to do with my 403B, which is a 401k for nonprofits. And so I just asked my colleagues, so, well, what should I invest it in? I didn't even know. So he said, oh, I like to have safe investments. I would do an annuity, which was earning like 4 to 6%. And the stock market, of course, I didn't know that at that time, was earning 9 to 10%. I said, that's a big difference over decades. So I decided when I learned about the stock market that I would invest. And ever since then, I've really taken care of our investments. My husband even, we decide together what to invest in, but he really trusts me with my money and sometimes his money too.
That's great. Yeah, those conversations are really essential, right, for couples to have that true partnership. And not everyone needs to be expert. You just need to be engaged and make sure you've got a good process to manage your
Absolutely.
resources.
One of my fellows, proudly said, "Oh yeah, no, we invest our money." I was like, "Well, do you know what you're investing in?" She said, "No, but my husband does." And I said, "Please know what you're investing in, because you don't want to find out later in your years, if something happened to him, that he was probably investing in bonds or whatever, something that you would not be happy with." So I think I want to empower women. I want to empower my younger mentees to learn about money and own their money.
I love that you do that, because they probably think that you're going to focus on medicine, but now you're helping them focus on their own financial well-being. But as a mentor to them, also as a cardiologist, since it is still a male-dominated arena, how do you coach and inspire and support women that come to you that really need your advice and counsel? What do you find are some of the ways that you really step in to help them?
So, like we have done in the past, we've had some financial people like your company come over to Rush and teach us about how to invest money. And because I have some leadership positions in the national organizations, I do have a say in what we talk about. And I always emphasize finances. People don't negotiate their salaries, especially women. Women don't negotiate their salaries or their benefits. And I empower them to talk about all those things, because those are what makes people happy, having that financial independence.
And I'm just curious, Annabelle, what are some of the recurring themes you're hearing from your colleagues or just others in your circle or network around why they're not owning, their power around their finances, or just around their life in general? Is it lack of confidence? Is it just lack of resources, lack of direction? What are some of the things that you see?
I think it's just lack of knowledge from, your parents teach you a lot of things. And when parents don't teach their daughters about money, they'll teach their sons, but not their daughters about money. They grow up thinking that they don't need to know about it. And I think we need to change that. And so when my kids were growing up, I taught both my son and my daughter about finances. And so my daughter does know about finances, and she knows how to invest her money. And so I'm really proud that she's gotten it. Some of my fellows have not gotten it. And so we keep telling them They're too busy. They're really too busy taking care of
Yeah.
patients, and they don't make it a priority.
Well, I think a lot of women fall into that camp where we focus on everyone else except for ourselves and what we need to manage for. That's part of self-care, right? To evaluate and monitor your finances so that you can ultimately create this life that you're envisioning to live beyond your work years.
Yeah, no, it's true. I have a short story that I can tell you. When I have my nurses at my house in Michigan as a retreat, we started talking about in money, and I said, "Are you guys making sure that you're investing your money into a good retirement fund?" And one of them was good. She said, "Yes, I think I know what I'm doing. I've invested my 403b in good stock funds." And one just started crying. She just started crying. And I said, "I'm sorry. Are you okay?" And she felt so bad that she had never invested any of her money into anything. She did not feel she could afford it. So she wasn't even investing. She wasn't even putting away what Rush was matching. And so, like I said, let's make this a learning point, and we will help you. We will teach you how to make that happen. You need to have a budget, and you cannot go over that budget because you will not have enough money to put away for your retirement. I think she's one of those people that felt like she was just going to get married and her husband was going to take care of her. And she was already in her 40s. And so, it was an eye opener for her.
Yeah. Sounds like it was an aha moment. And, one of the things that story reminds me of is that we really need strong women like yourself continuing to lead the way and reinforce some of these key points. I'm going to shift gears for a moment, if you will. Barbara mentioned a second ago self-care and all of these just amazing positions and leadership roles that you hold in throughout your career. I'm curious, how do you kind of decompress? How do you practice joy?
Um,
Or
so
what brings you joy, perhaps?
my friends and family. My family first, of course. My friends are just a joy to be with. I have several wonderful friends that I just love to travel with. One of them is an OB-GYN at Northwestern, and we've been friends since college, and we just ended up in the same city. And we share our lives together. Our kids have grown up together. And I have another friend who has matching kids, and we have the same energy and the same personality. And so we all get along so well. And so that just, grounds our families to have friends that support you. And we know we can go to them if we need it. We don't have family here in Chicago. And they don't either. So whenever we need anything, they are our family. So it's comforting to have that. The other things that bring me joy are, of course, reading and doing research. I love to do research, and it brings me joy to answer a question. I tend to think a lot about medicine and cardiology and what we can help our patients with. And last year, several of my friends called me and asked about their parents. They were in their 90s or late 80s, and they knew that I specialized in arrhythmias, and they asked me, should we put them on anticoagulants, on blood thinners? And I said yes, but we need to make a document about this so that people are not so worried, and we want to make sure that this is the right thing. And so it took me a whole year, but I gathered a few experts on this, and we wrote a paper that was just published on the management of atrial fibrillation in people over the age of 75. And so that brings me joy, tackling a question in medicine that I can educate people about. that brings me a lot of joy to see, the work that we do published and appreciated by a lot of people.
Mhm.
Yeah, there's
Great.
so much value in that, right? And so, do you work a lot with the doctors you oversee to encourage them and to come brainstorm around different research projects?
Oh, absolutely. As you mentioned, I'm the vice chief of academic affairs, which makes me one of the person who's in charge of making sure that we have academic productivity. And so when COVID started, that's when I started as the vice chief. I took that opportunity to gather everybody and rally everyone to do research and around this disease that we didn't know a lot about. And it's been an incredibly rewarding time for us at Rush, because Rush is one of the best hospitals who tackled COVID or tackling COVID. We just have been a great resource for a lot of people. And so our residents and fellows were hungry for knowledge. And so we gathered a lot of information from the databases, and we've been writing abstracts and writing papers. And it's been incredibly rewarding for us to be able to do that and publish our work. And we're continuing to do that. And that brings us a lot of joy too.
I
That's
bet.
fantastic.
And I presume some of the findings are beyond just the impacts of COVID, but just learning more and new things around cardiology and heart issues.
Absolutely. Because a lot of the news, you'll hear statistics, you'll hear mortality data, but we are studying the nuances of whether women are doing better or worse than men. We're learning, does diabetes or obesity or heart disease increase your mortality? So we are studying the nuances of who is really being affected by COVID.
Hmm.
And what should women prioritize to maintain good, good heart health?
So it's not just about nutrition or physical activity. A lot of it is stress management. There's good stress and there's bad, toxic stress. So good stress is when you get empowered or you want to get a lot of energy to get something done. You want to take a test. That's stressful.
Hmm.
That's good stress. So the right hormones come, but then it goes away. But then there's stress that doesn't go away, and it keeps your blood pressure up, keeps your heart rate up, and your hormones start to really affect your body. So you need to examine the stresses in your life and whether it's toxic or good stress. And if it's toxic stress, try to get rid of it as much as possible. That's probably one of the most underappreciated risk factor for diseases such as heart disease and cancers and a lot of other diseases.
It's funny because Barbara and I are such advocates of the saying, focus on what you can control and let go of the rest. And in terms of just getting rid of those, toxic stressors, what are some of the modalities that you suggest women use? I mean, is it, I did deep breathing this morning, or meditation, or physical? Like, what are the top kind of 2 or 3 things that you would suggest women employ to let go of some of that, and so they're not carrying it around?
So exercise is probably one of the best stress relievers. It has a positive effect on so many things. It
Hmm.
decreases the stress hormones. It decreases your blood pressure, decreases your weight if you don't overeat. Just be careful not to over exercise because you don't want to injure yourself. And then that, leads to a lot of different problems. So just know your body and know your limits. Exercise is a great stress reliever. And I agree that meditation, deep breathing, I do transcendental meditation. I learned how to
Hmm.
do it. And it really, really helps me decompress and also become more creative. When I'm doing meditation, I often think of things that I want to do. And of course, you're supposed to not think during meditation, but good creative thoughts come when you're trying to meditate.
That's funny. It's so true. Well, actually, I've used some different apps and tools, and they say not to get overwhelmed and beat yourself up for when your mind drifts. That's just natural, and just try to
Exactly.
bring it back, right?
Right.
Um, so I do have another question. If you ran the world, you kind of do, I think, sometimes, Annabelle, but if you really ran the world and
my,
had
my
supreme
little
power,
world.
what's the first change you'd make? Like, what is the change? What change would you love to see?
Thank you for that question, which is very, very difficult because there's so many problems in the world. But I think that one of the things that I wish for the world was for people to be more tolerant of each other. There are so many wonderful cultures, different cultures that we can learn from. I travel a lot because I love to learn about different cultures, different countries. The earth is so beautiful. And the cultures that have come out of these beautiful places in the world are just really amazing. And if people just stop being so insecure about their power or what they have, and open their minds to the beauty of different people, different cultures, I think they would be happier.
Yeah, agreed.
Yeah, I totally agree with that. And talking about just different cultures and different people, who outside of medicine, who inspires you and why?
Um, I think there are a lot of strong women outside of medicine, like Ruth Bader Ginsburg, who I happened to be on the same plane with just before she died.
Oh my gosh.
It was right before the pandemic, and I was traveling from New York City right after I got the award for the Red Dress award, and I just happened to be going to Washington, D.C., and these big men and women were surrounding this tiny little old lady. And I said, I wonder who that is. And then I realized, oh my God, it's RBG. And I was just so thrilled. And her security guard sat right next to me. And before I knew she was RBG, I said, would you like me to sit on where she's sitting so you can sit together? She goes, oh, no, she likes to sit by herself. And then I knew that was somebody really important. But, she's one of our most amazing heroes. She was a tiny little woman like myself, and she didn't let that stop her from doing anything.
Yeah.
I just so admire these strong women that have rallied to help other women, and not just women. I mean, other people who have not been, who didn't have a voice. So
Yeah, great. Thank you.
I really admire those strong women that can do that.
Well, and actually, thank you, because in so many ways, you actually help other women, especially cardiologists and other women in your circle, really step up and own their voice, and really step into their power. You impressed me so long ago when I expected you to focus on the women that you oversee at Rush and that are in your team, that you want to talk to them about medicine. And you were all about making sure that they were self-advocating, which means their compensation means investing their money, and that they own that power. And so that's such an important message, and something that I don't know many other doctors make those same types of suggestions and priorities for their team members. So thank you for that.
Well, I'm happy to tell you. I'm sure you know because it's your company that's speaking to the next webinar that the American Society of Echocardiography women are doing, and I'm seeing more and more of these webinars happening. So I think we started something,
I
and
think
I'm
so.
pleased about that.
Me too. So are we. Absolutely.
And I keep seeing that cardiologists are among the top earners in medicine, and so these women are earning a lot of money. And even if they're earning 80% of the men's salaries, it's still a lot of money. If cardiologists are earning over $400,000 a year, and that's a lot of money that they should really learn about how to invest.
Absolutely. And by coaching them and helping them publish and helping them step up and negotiate better, I think in encouraging them to do that, you're helping them not be party to that traditional gap that we see between men and women. So thank you for helping to close that gap.
Absolutely. I'm trying one at a time.
One at a time.
One of my former fellows said, Dr. Volgman, you'd be so proud of me. I negotiated my salary and I'm making more than my male partner. I'm like, good for you.
Yeah.
So,
That's
one
great.
step at a time.
Well, when we have fierce advocates like yourself out there, not just talking about cardiology and the importance of heart health, but also the importance of staying engaged in your finances. One of the things that we see quite often in the medical profession is that physicians are so focused on patients and on teaching and on research and so on, and so we are just huge advocates of helping everyone, but especially women, lift up their heads, look out, because as Barbara said, they focus outwardly rather than inwardly. And there's nothing more important because we can't take care of everybody else unless we take care of ourselves. And getting them to focus, on their finances and their financial freedom is just so essential. So cheers to you for what you're doing, Annabelle.
Absolutely. Thank you so much. It does seem counterintuitive for doctors to be talking about money. And we don't like to talk about money. We talk about taking care of patients. And, when you are a top doctor, they don't care how much money you make. They want to know how well you take care of a patient. And that is first and foremost. Making sure that we're taking good care of our patients is definitely our life's work. But you hear so much talk about burnout. And people are burning out not because they're tired, it's because there's just too much work to be done and they're trying to make us do more than what we can. And so it's not that we're suffering because of ourselves, but because of the system. And so we can't feel guilty about feeling burnt out. We have to solve the system. And part of that is that they feel that they can't take time off, that they can't take vacation because they don't have enough money. Well, I think that when people are starting to burn out, they have to take those vacations. They have to take time off for themselves. And that's where money comes in. And so it's all part of it, that financial security gives you peace of mind so that you can take those vacations that you need and not feel burnt out. And you don't want a doctor who feels burnt out. They're not going to be as good a doctor to take care of you because they're just too tired and they can't think straight. So it's all, important.
Well, that's all about kind of the theme of the recharge, our podcast here. So we totally understand that.
Right.
Yeah. And what we underscore is how we all need to pause and reinvest in ourselves, because unless we do that, we can't take care of others, right? I mean, we forget.
Absolutely. Exactly.
Right.
Exactly.
Is there anything we haven't really talked about, Annabelle, that you were hoping we'd have a conversation about today?
Yeah, I guess the biggest question is how long, should we make sure that our money will be enough for how for the rest of our lives? That's always a big question, right? And if you guys can help us answer that, I can tell you that most women are living till their 90s and men till their late 80s. So we have to make that money work for us so that we don't run out of money.
Right. Well, that's why when we do the modeling for our clients, it's so important that we look at longevity. And in some families, you might want to default to 100 years. I mean, there's so many people living so much longer. Most of our models go to the early 90s. But that's important to stress test your finances and project out whether they'll remain sufficient to support you throughout your lifetime. That will help people reduce their stress if instead of not paying attention to their finances, they'll look at their life plan and create a financial plan and see if there's a gap between what they want to do and how much they can afford to do. And then they can then manage that gap, hopefully, so that they can then support their lifestyle throughout their lifetime. That's really best practice.
Yeah. It is. It's a great point, because when you feel like there's enough financial stability in your life, you feel more peaceful in your life, and that decreases stress, which is great for your heart. So all of this advice is good for the heart, right?
Exactly. Yeah, great collaboration that way.
Exactly.
Well, as always, thank you so much for your time, and this conversation has brought just some new ideas, I know, for me and Nancy. So we really appreciate you being with us today.
It's my pleasure, always. Thank you so much.